Type 1 diabetes and nutrition. What is type 1 diabetes? Type 1 diabetes, once known as juvenile diabetes or insulin dependent diabetes, is a chronic condition in which the pancreas produces little to no insulin. Insulin is a hormone needed to allow sugar to enter cells to produce energy. This sugar is also known as glucose. Type 1 diabetes is less common than type 2 diabetes and is typically diagnosed at an earlier age than type 2 diabetes. I chose this disease because I have had family members who have had to manage their diabetes, and I thought it would be important to educate myself on what this condition truly is like and what it does to the body. So, the risk factors for type 1 diabetes look a little different than your average set of risk factors for a disease because it is a chronic disease. So, family history, presence of autoimmune cells, and age are taken into consideration. And like I said in the first slide, um, type 1 diabetes is diagnosed at a younger age, so that's why age is considered a risk factor. Symptoms. Symptoms of type 1 diabetes include intense thirst, frequent urination, fatigue, tingling or numbness in the hands and feet, blurry vision, hunger, nausea, vomiting, and stomach pain. Complications of type 1 diabetes. Aside from the disease itself, type 1 diabetes has complications that make managing the disease more difficult. These complications include the following: vision problems, kidney damage, nerve damage, skin sores and skin infections, and high blood pressure. Nutrition and type 1 diabetes. For people who are managing their insulin, it is recommended to eat a meal around the same time as an insulin dose. Not doing this could lead to high blood sugar. And I just wanted to talk about the role of insulin. So, it allows the pancreas to secrete, or the pancreas secretes insulin into the bloodstream. Insulin circulates, allowing sugar to enter your cells. This allows insulin to lower the amount of sugar in your bloodstream, and as your blood sugar level drops, so does the secretion of insulin from your pancreas. So, insulin is very important for your blood sugar, and obviously, eating foods that are high or too low in this could kind of throw the system out of whack. So, I just included some foods that are okay for most people with diabetes to have, and they're typically under 15 grams of fast acting carbs. So these snacks include a fourth cup of fruit juice, 4 to 6 crackers, 1 tablespoon of honey, 3 ounces of grapes, a half cup of peas, and then I included a link where more information about this can be found at because the list was very long and I could have had 3 slides on just snacks that are under 15 grams of fast acting carbs. And then foods that are suggested to avoid are sodas, simple carbohydrates, and trans fats, as they are very high in sugar, which can also lead to high blood sugar. Healthy habits to help with type 1 diabetes. So, it is recommended to keep a very active lifestyle. Aiming to get at least 30 minutes of physical activity 5 days a week is very important, along with incorporating plant foods such as leafy green vegetables and low sugar foods into your daily diet. Avoiding sugary drinks like soda, pop, processed juice, alcoholic beverages, like I mentioned in the slide before, is also very critical to helping with the side effects and managing type 1 diabetes. And here are just some of the resources I found for getting my information for this presentation.